Hello, everyone, and welcome to our next episode of Decoding AI in Healthcare. We are honored, and it is our pleasure to have Dr. William Weeks today, who is a MD, PhD, MBA, a physician economist, a rare bird, if I may say, leading Microsoft's philanthropic AI for health effort. There, he conducts research in concert with non-for-profit organizations and academic centers designed to improve health and health outcomes by applying AI imaging, public health, and large language modeling. Dr. Weeks has published 2 books, one of which we're going to talk about today, and has over 250 peer-reviewed manuscripts examining economic and business aspects of healthcare services utilization and delivery, physicians' return on educational investment, healthcare delivery science, and healthcare value. Dr. Weeks has been honored with the 2009 National Rural Health Association Outstanding Researcher Award, the 2016 Jerome F. McAndrews Award for Excellence in Research from the National Chiropractic Medical Insurance Corporation Group, the 2016 Fulbright Tocqueville Distinguished Chair at Aix-Marseille University, and a 2020-2023 Fulbright Specialist Award. Dr. Weeks' research has been funded by CMMI, NIH, the Commonwealth Fund, the National Chiropractic Medical Insurance Corporation Group, the VA, AHRQ, and BUPA. We are honored to have Dr. Weeks. Thank you so much for joining us today.
Well, it's my pleasure. It's great to be here.
So I think I'm just going to cut to the chase and start with the book that is on the shelves today. It's called AI for Good. It's a super exciting read, at least in the world of where Amit and I live, right? AI has been the hot topic, but this is a topic that's different from the rest of the books that are out on the shelves. So what inspired you to write this book?
Well, I joined Microsoft about 5 years ago after a 30-year career in academia, and then took on this job working within the AI for Good research lab, which is a philanthropic effort of Microsoft, as you said, and where I run the health portfolio. And so much of the work in artificial intelligence and machine learning is spent having people trying to convince people to click more, right? You click more on a website. Our funded efforts, funded by Satya Nadella and Brad Smith, the CEO and the president of Microsoft, seeks to really use these tools to address and help solve some of the complex world problems that we have. And so the inspiration for writing the book was that we've done a lot of really cool stuff and done it just to make the world kind of a better place using these newer methods of analytics and evaluation. And we kind of wanted to share that. We're proud of what we do. We're in this very unique role within a complex organization that's really a delightful job. And we wanted to share the great work that our teams have done and that the lab has done over the past several years.
Fantastic. So, Dr. William, a warm welcome from my side to our podcast. It's really an honor to have you with us. And we have so many people across the globe from our medical fraternity that was looking forward to have this conversation with you, where we can actually understand the perspective of and the role of artificial intelligence in healthcare. So, and congratulations on the fantastic book that you've come up with, AI for Good. And having read the book to some extent, not the whole of it yet, but I'm still completing it. So, in your book, you discuss about the Microsoft's uses to tackle the global social challenges. And when we talk about social challenges, Dipu and myself have been discussing about what if someday AI can bring equitable healthcare distribution in most parts of the world. So from your point of view, from your perspective, even what you've shared in the book, could you tell us and our audience about how the AI technology currently can be reshaping in solving the humanitarian or the health and the environmental issue?
So, we give several examples of how we're kind of identifying areas at risk for, earthquakes or fires. We did studies immediately after the earthquakes in Turkey and then the fires in Hawaii, and how we can kind of model, drought and the impact potentially of floods on different areas. Those are all kind of, climate and sustainability issues. Juan and I, my co-author Juan, who is the director of the overall lab, we wrote an editorial as well that kind of suggests that all of the sustainable development goals, including climate and equity in general and gender and all the different things that they're trying to address, they all influence health, right?
Yes.
Health is a central thing. But for health, we wouldn't be doing any of them, really. To be honest, right? So the opportunities to use AI and these new cool data streams, like from satellites, from animal traps that can identify species, audiological capture, where you can identify the numbers of birds or different types of whales that are being seen across the world. Those can all be used to support sustainability and to address climate change, which again then has this positive impact on health.
Yeah, I mean, that's fantastic. I was watching one of the podcasts by your co-author where he speaks about, how you can use the sounds of the animals in the Amazon to kind of predict their behavior. And that's fascinating. I mean, such fascinating technology we have. Dipu?
I know it's what a time to live,
What a
Yes,
time to
absolutely.
live in, exactly. And and I think you touched on what you're touching on is an expansion of what we had in healthcare have historically called social determinants of health. This is
Yes.
an expansion
Yes.
of that model to probably a model that was needed for much long ago, but now we're finally starting to have the technology to kind of bridge that gap to allow us to finally collect data so that we can impact outcomes, whether they be environmental or social or in a public health realm. But as of course, with any challenge, whether it's large or small, there are some significant challenges that we end up kind of facing. And as you look, I guess, ahead, when applying AI in fields like healthcare and disaster relief, what are some of the challenges that you have noticed and how have you overcome them? Or are there other things that you foresee in the future that we're going to have to start thinking a little bit outside of the box on?
Yeah, so I mean, a couple of challenges, and maybe I'll focus on healthcare both for the audience, and that's just kind of what I know best. So some challenges are that these models are expensive to run.
Yes.
They're not cheap, and there actually is some adverse climate impact on those, right? Because they use
Yes.
a fair amount of energy. So what I suggest always is that we don't throw AI at everything. Sometimes people get really excited about technology just for technology's sake. We should focus on making sure that it's being selectively applied to be effective. Bill Gates has a great quote where essentially he says, if you apply technology to an efficient organization, it'll make it more efficient. And if you apply it to an inefficient organization, it will make it even more inefficient. And healthcare is not renowned for its efficiency, right?
Yeah.
So we have to be cautious about how we do it. So that's kind of the big thing is let's be cautious about it. Let's test it first, make sure it's actually doing what it's doing. And any use of technology, in my view, that doesn't achieve at least one of the quadrants of the quadruple aim or promote that, which is, improving the patient experience, the provider experience, improving outcomes and quality of care, and also trying to reduce healthcare costs in the denominator. If we're not doing at least one of those, we shouldn't be applying the technology, right? So that's the first thing. The second thing is the question of bias, right? And here, the challenge is that, to be honest with you, most of the healthcare recommendations for the world are based on studies of people that look a lot like me. And they may not be broadly applicable to everyone else, right? Both gender and age and skin color. These are all challenges, right? So we want to be cautious about using algorithms that are just kind of based on, again, people that look like me and don't look like the people who are being treated. I think, again, the reality is that the biases exist right now. So we shouldn't hold off from using stuff to improve healthcare and improve that quadruple aim while we wait for perfection. because perfection will never come. What we can do is train the models on the people who live, have the same demographics of the target population. And I think I'm actually quite hopeful, because with more data of a variety of types, from EMRs to radiology to genomics, we can actually train those models pretty well and essentially figure out, without doing randomized control trials, what works for particular people in particular different states of illness and maybe demographics as well in a particular region. So I'm very hopeful for that. And the third issue that I run across in healthcare in particular is, again, this kind of desire for perfection, that what will happen is there will be a paper that's published and they'll use like a large language model to answer questions. And they compare it to the 3 top doctors in the world on that particular topic. And maybe AI doesn't do, maybe it only scores an 86% and the doctors score 95%. The reality is that no one statistically gets care from the top 3 doctors in the world, right? They're the best. No one in the world gets that care. So I think we need to be careful about what we compare to. And if the AI models are doing like, 80 to 85 percentile, that's pretty good. And if everyone were to get that, that means that everyone under 85 percentile is getting a bump up. The models should not replace providers. They should support providers. They should be there for decision support. So we're just kind of improving care quality. And it's very challenging for the providers in the room to understand, with all the new information that's coming out every day in journals across the globe, you just can't keep up. So using these models can be quite helpful in maintaining kind of quality of care and currency of what is best to be done. So those are the challenges and maybe solutions to each of the challenges as well.
I think what you're pointing to, and Amit, I know you're going to ask the next question, but one of the things that I think of as you're talking is that as AI models and AI becomes a little bit more ubiquitous in the care delivery, it's a shift in care. I'm sorry, it's not a shift in care that we're delivering, it's a shift in practice. So it's the how rather than the who.
Yes.
And I think this is the difference that I think we need to start kind of talking about, because the hype is still kind of going on, but in the background, healthcare providers like Amit and I are sitting there thinking, okay, is this a good tool for us to use? Do I need to spend my time learning this for the patient population that I serve? And I think Amit serves is a diabetologist, and so he serves a particular population, and there are several tools, and he's going to get to pick and choose which one he uses in his daily life. So Amit, over to you.
Yeah, so I think from the last answer that William just gave us, I think very important point comes up. And for all our viewers out there, he spoke about the bias, which is so very important. He spoke about evaluation. He spoke about validation. And I think these are some of the questions that we are all trying to answer today in 2024 and 2025, perhaps, how we can best evaluate with the research, we can get a clinical trial running, we can have it validated. So with all that, and with all your experience and with all your efforts at Microsoft, William, what are the areas that you really see with all the work that you're doing that AI is going to transform healthcare? If we ask you the top 5 or 6 places that you really see AI transforming healthcare, let's say through Microsoft or as a whole, how do you see that happening? In which places?
So I think AI can be used really effectively to essentially expand the provider workforce. Providers know that they spend a lot of time treating normal, and a lot of times seeing people that really don't need to be seen. So as a triage mechanism and a support for triage and for self-care when it's adequate to just treat oneself, we can really essentially expand the provider workforce, right? One example we use in the book is we developed this way to do video screening of kids that have the chance of having retinopathy of prematurity. It's the biggest cause of childhood blindness in the world, and there are more and more premature kids who are living. So there's more and more kids who are going to be susceptible to it. So by using a phone and a magnifier, we have developed a process wherein the clinician, and it can be frankly a community health worker, can dilate the kid's eyes, take a video. The video can say, are there good views of the fundus or not? Because if they're not, you can retake the video right then when the kid is still has their eyes dilated and is sedated. So you take the video, and then if there are good views, it can then suggest, yeah, this kid has a likelihood of retinopathy prematurity or not so much. And then your very scarce pediatric ophthalmologists can be treating with laser, because it's treatable if you identify it. It can be treating with the lasers and the medications the kids who actually need it. So they're not spending their time screening, they're spending their time treating. And if they're spending half their time screening, you just have doubled the workforce, right? In essence. So I think that's, expanding the workforce by using these triage mechanisms and helping identify who really does and who doesn't need to be seen is quite helpful. A similar kind of a mechanism there is to help particularly radiologists who may not have so much experience in particular areas. So we're working with Johns Hopkins University on pancreatic cancer and identification of pancreatic cancer. They have some of the top radiologists in the world around that particular area, but not everyone has that kind of experience, right? Pancreatic cancer is pretty rare, and you tend to find it incidentally on an abdominal CT scan or something. So your typical radiologist may not see many cases of this. If you have the AI, it can actually have them focus on, look here again, right? Take a more careful look. And so they're more efficient, but they're also going to be more accurate and capture stuff better. So the quality of care will improve as well. I think the patient experience is improving with artificial intelligence, and in particular, kind of the large language models. When you used to do a search, whether it be on Bing or Google, you would get just a list of a whole bunch of things, right? So you do a search on something health related, and you just get a list of all these things. And as a practitioner, I would remember when I was treating patients, patients would come in with a thick stack of printed out papers, and you'd have to kind of go through it and say, these are all the reasons that this doesn't apply to you or whatever. So you have to, now it's very readable and understandable, right? And you can ask a question and get a pretty reasonable answer. And there have been repeated studies that have shown that actually, when you ask GPT versus doctors some questions, basic questions, the answers are more thorough, and they're equally as accurate, if not a little better. And importantly, they're more empathetic than the doctors are, right? It's actually a nicer response than you would get from a doctor. So this kind of will expand, again, patient knowledge, patient decision-making. We've actually written a paper about how using these large language models, you can better understand what the different options for treatment are and make then a more informed decision for yourself. So expansion of the physician workforce, bringing care to the patients better, and understanding and knowledge, sharing that knowledge so there's not that big knowledge differential, so they can be more informed, and then focusing people on what needs to be looked at when they may not see so much of it, are all kind of three areas that will, I think, help with healthcare. From a kind of a simple back office operation in countries where there's insurance requirements, and like in the US, right, you have to have these you have to have approvals for certain things. The GPT models, the large language models, can very rapidly generate draft letters that are very, very good. And so the providers can spend more time treating patients and less time doing paperwork with basic stuff.
I'm going
like
to half
that.
facetiously say they could just do away with that department altogether.
They could.
It would be okay.
Probably have a role change. Probably we have a role change. I think we should give out the right message.
Yeah. I think the challenge is the insurers may have their own GPT, so you may have GPT just going back and forth and back and forth. But
Yeah.
Right.
But with all the transformation coming in healthcare, I'm so glad we had so many friends wanting to ask question to William. And there's one question that we have from one of my dear friend in India, Dr. Bharat Sabu, and he's also one of our co-founders of Doctors AI. And he wants to know, William, is that with all this transformation and change coming in, there is always going to be question of ethical use, transparent use of AI tools, especially with generative AI and large language model. So through your book, you've also mentioned about equitable health coming in through the AI for good. So, like, how can, like, what are the views and what are the visions of Microsoft's in ensuring that there is, AI which is there ethically, yet it's explainable, yet it's transparent to the end user?
Yeah, so from an ethical standpoint, I think it's important to remember that AI has been around for a long time, right? It was
Yes.
conceptualized actually at Dartmouth College in 1956. So for 6.5 decades, it's been here. And every time you use Netflix or Amazon or drive a car, you're using AI. I think all the hype is around GPT, right? Which just came out a couple of years ago. And so there's all this hype and stuff about it, but it's been there for a long time. And Microsoft has had an ethical AI department for something like 30 years already. So they take this seriously. We have guidelines about ethical and responsible use of AI. We participate in all sorts of different organizations, whether it's CHAI or Train, or the Biden administration recently released guidelines on AI in general and in healthcare. The EU has released these kinds of things. So we participate actively in making sure that it's used in a responsible and ethical way, and testing and constantly trying to improve that aspect of AI is important. I think with regard to interpretability, there are tools you can use. And that's actually one of the other barriers that you have with healthcare providers, right? Is we go to med school for quite a long time and we go through residencies. And so you don't want something just to say, just do this, right? You want some kind of explainable AI model. And there are these things, right? There's things like generative, what are they, GAMs, generalized additive models that can show graphics and say, here's the relationships internal to the model that are driving the output. You can also use like SHAP values that can show you kind of where the priorities are in describing the models. And I think that comforts providers. So they know it's just not this black box that they can't understand. They can actually, it can make sense to them. Just like, pathophysiological basis of disease makes sense to them. There's a timeline, there's an order, and stuff like that. And so that kind of brings up another challenge that I think is you can overcome, which is sometimes that, the data scientists and the computer scientists that do a lot of this AI work may not be versed in healthcare, right? They may not have experience in healthcare, just like we don't necessarily have a lot of experience in their world. So left to their own devices, sometimes they will throw everything in and they just will come out with something. They'll say, here's what I found. These are the statistically significant ones. And, and I'll say, yeah, that doesn't make any sense though, right? There's no kind of pathophysiological basis of disease. So what we found repeatedly is, and in the book, we say this a lot, right? That the of, experts in AI and computer science and data science with subject matter expertise working together to come at some solution is critical. And there you have this back and forth between the providers and the computer scientists to say, does this make sense or not on both ends, right? To come to some kind of collaborative endpoint. So to me, that explainability is maybe part of that process, but part of the output as well. And the ethics part also is part of that output. And we want to do good here. We don't want to do just a common thing I will say is when I give talks is that when you go to business school, the kind of caption is caveat emptor, right? Let the buyer beware, right? In medicine, we say primum non nocere. Don't, first do no harm. So it's very different ethics behind this, right? We don't want to harm people. I think at Microsoft, the approach of AI and responsible AI is the primum non nocere thing, which is really delightful to see. We don't want to use these tools as weapons. We want to use them for good.
Yeah.
Fantastic.
And just to elaborate on your point a little bit, I've been saying for a while, and I think Amit will agree, that I think to harken back to a previous comment you had made about how we should have involvement of multiple areas of collaboration. And I do see a shift in how we are going to practice care in teams in the future, where we will have data scientists and computer scientists and data analysts on our rounding teams in the morning, right? Like we're going to say, this is patient X in front of us. That person is here for blah, 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 blah. And by the way, so-and-so data scientist or analyst, what is the AI saying? What's the data? And then the clinician will be able to interpret that and say, yes, yeah, or no. Expanding the workforce is going to be part of these sort of cross-collaborative, cross-industry teams that are going to be part of healthcare in the future.
Yeah, absolutely. I totally agree. And I think, it is, I work with this lab in Cambridge. We sponsor them, the Vandershar lab in Cambridge, UK. And Michaela Vandershar is brilliant. She's a data scientist, and she says, I am no interest in learning medicine. It's complex. It's this whole different thing. The doctors are probably not going to spend another 8 years to learn AI, right? We have to collaborate and work exactly as you're saying as a team to figure out, again, what's best for a patient. How do we do this right and ethically, and to advance the quadruple aim, and not just for making money on insurance or something.
Right. Oh, and so, and to that point, that leads me to my next question in terms of, so we're seeing these emerging trends in workforce transformation. Hopefully we'll see them in the next few years and decades. What emerging AI technologies are you most excited about, and how do you anticipate they're going to contribute to the social good?
So I think the large language models, are really transformative in the ways that they're now able, with this newest release, right, to use kind of virtually anything, not just text, right, but audio, video, anything to interpret and summarize and guide. So I think that's going to be very transformative. Our CTO, Kevin Scott, said that, the advanced AI models is kind of likened to electricity. And when electricity came on, there were certain uses, but there were a whole bunch of uses that we couldn't even think of. And I think it will be kind of like that. In the short run, the generative models will be very helpful in, like I said before, provider kind of efficiency in keeping up, patient knowledge and education. Even we're working some with the World Health Organization on how to interpret text from multiple news feeds that they get to identify where there might be new epidemics that are starting up, right? It can be much more efficient. We're working with an organization to try to figure out if the large language models can be helpful in guideline development, so that you don't wait. It takes a lot of effort and of human abstractors to get the information, to narrow it down. And so by the time you actually get the guideline, it may be, the data may be a year or 2 years old, right? This I think could massively accelerate that process and probably get very, very good start. You always need a human in the loop in this stuff, but at least the abstractors will have a great head start at getting things done. So it can be, the guidelines can be more up to date and done quicker and cheaper, which was good for humanity. So those are kind of the areas I think that
Fantastic.
Will help. Yeah.
So William, the whole idea is about collaboration, and we're so glad that it comes from you about, there has to be a big collaboration between the people who are building the models, who are testing the models, and versus the end users and the clinicians who will actually be addressing and asking those need gaps, and they will be using the model. So one question to you from most of our users is that at the AI for Good Lab, when we are looking at a future, probably with the help of Microsoft, towards equitable healthcare, how do you sort of plan on these collaborations, with all the stakeholders in one place, with the policymakers, with the government, and then you have the clinicians, the organizations, the association of the medical associations coming in, and of course with Microsoft and the other parties involved. How do you envision these collaborations happening, and what are the policies that you're taking?
Yeah, so it's an interesting thing. So we tend to work around projects, right? And the way that we like to work is we will have a not-for-profit organization work on a project that doesn't have any kind of commercial potential that's obvious. Right. Because that would go to Microsoft Research, who has other interests in commercialization. So ours is, again, just to do good and to kind of prove the art of the possible. Is this something that's doable that AI and machine learning can help with? So we work with these not-for-profit organizations. We come up with a project plan, just kind of like a grant, but a very mini one, like just a one-page kind of a thing. And we agree that this will be the approach that we take. We then provided Azure tenancy for them for free. They put their data on that and grant us access to that data after we've gone through what is sometimes an elaborative and time-consuming generation of a legal document called a research collaboration agreement, where we all agree that this is fine to do. And then we collaborate with them on the research, meet with them regularly, and then come up with the solutions that we can find, and then publish the article in an academic publication, as well as publish the code on GitHub. And then any IP that's developed belongs to the partner. And they then, my hope, frankly, is that they do commercialize that in some fashion. So that, because I find it hard to believe that without some commercialization and ease of entry into the workflow, it's going to be tough to kind of spread this stuff and scale it. So I think that's a necessary thing, but the not-for-profit can further its mission by such commercialization, frankly.
Yeah, but that's amazing, because it opens up the window for so many bootstraps and so many startups, who are trying to collaborate at smaller level, and they're trying to work on the regional data in smaller geographic population, that they can collaborate with something like Microsoft at the AI for Good Lab and come up with a collaborative project which can eventually be something which is financially viable for them. So that actually opens up a fantastic ecosystem of AI development, a diverse set of AI development. That is something that we need.
Exactly.
That's really, yeah, no, I one additional comment is that, we always hear of AI companies they're always for profit, they're in the business, so to speak.
Yes.
And it's really nice to know that the AI for Good Lab is there to kind of promote the nonprofits, and really,
Fantastic.
because their mission is to really serve society or whatever problem they're looking to, whatever their mission is. And I think it's a fantastic venue to have, because the nonprofits often don't have the resources that perhaps a formal startup would have. And so that's a fantastic.
Yeah, and just to be clear, we, like I said, the Azure tenancy that's provided is free to them. Our work is free to them. So there's no, we're not charging for any of this stuff. And in our lab, we're very unique. We have no sales expectations or revenue expectations. It's all just for good.
You have my dream job, Bill. I think
I have my dream job, I swear. And a dream team, I swear to God. This team is spectacular. Juan is just a tremendous individual from Uruguay, and he's worked in this area forever. And he kind of wanted me. He's great because he, just like Michaela says, I do data science. I need subject matter expertise. And he and I, my first week I was at Microsoft, I met him and we started talking about working. So we wrote a couple of papers before I joined his team. So he's just a delightful guy to work for, and incredibly sharp. And then the rest of the team, they're brilliant data scientists, and I think they truly do value the uniqueness of the job that they have, which is also it's mission driven, and
mission driven, and it's a rare thing to find in this day and age.
Yes.
So I guess in your experience, what have been some of the unexpected lessons you've learned about using AI to drive social change?
Well, for a long time as a researcher, I've known that collaboration is important. I think maybe the unexpected thing is just how critically important it is, right? Microsoft really does not, we don't have a lot of data. Sometimes people will come to us and say, well, surely you guys have all these data sets. We kind of don't. so reliant on collaboration with others if we need data to do analytics. So that collaboration part is critical. I think the complexity of today's world problems is so large that even a big company like Microsoft can't do it alone. They need help, and they need the subject matter expertise. But I think the future that I see that was maybe a little surprising is the value of these public private collaborations, right? And pacts that are developed. Because these are, there's a lot of data, there's potential for solving this stuff, but you can't go it alone. So I think that is kind of critical, and you can't go it alone. Even even just industry doing it alone. You got to do it with, like you pointed out, with not-for-profits with different perspectives, different patient populations, different goals, and try to kind of address all of those, which is very challenging. So though I guess the challenge of it, but frankly, the hope of is there too. I've been in medicine for a long time, and we did a lot of research on data elements in Medicare and different countries, even looking at different rates of health services utilization and so forth. The data now, the volumes are tremendous, and the potential for incorporating the social determinants and stuff like that, and the speed at which those data are coming in, where you can get them, you can get them at like county levels and country levels and things like that. I think the future is going to be, the wearables, the sensors that are around, all of that has just tremendous potential, I think, for actually solving some of these problems, and not so much of what I feel like I did at Dartmouth was just document them. Yes, this is a problem. now we can maybe solve them.
Now you can solve them. Yeah.
Yeah.
Well, I will, and to your point about the various forms of data coming in, we really need to make sure that it's good, clean data, because you
Clean
can't
data, structured data. That is so important.
data. Yeah, I would be remiss if I did not mention that, because Bob has taught me that.
But it's so fascinating, and I'm sure many of our users would be really enthralled with what you just said about the whole vision of AI for good lab, in how you are actually fostering these collaborations. And trust me, William, when I say this, you will be shooted with emails from so many people that I know who would really have got the set of data, and then what they want, a real project collaboration, to do really good to the community. But having said that, there's always been a public skepticism about the use of artificial intelligence. And largely in the medical community, from some of us, as like we've been advocating the good of artificial intelligence if used in the right way, we often feel that most of the skepticism is because of the lack of literacy about artificial intelligence, or the lack of proper skills, or the lack of proper knowledge. So from your point of view, and especially with the vision that the AI for Good Lab carries, how do you see that the skills of the medical professionals need to change, the education part, where they need to develop that knowledge about that particular AI tool that they're using, and the overall AI education that you see in the system? Is there any plan of incorporating AI education into the medical curriculum with the help of Microsoft? So what are your views on that?
Yeah, so actually, my longtime mentor, Jim Weinstein, was just giving a talk to the American Association of Medical Colleges, right? And I know this is a worldwide audience, but that association came up with the Flexner report in, I think, like 1909, right? That kind of defined, so 100 years ago, we defined what medical school curricula should be and how they should be coordinated and stuff like that. And Jim keeps saying, we need to transform that. This is a new Flexner report that needs to incorporate these tools. And when I think about it, I think, there didn't used to be stethoscopes, and then stethoscopes were introduced. And so we can use them for a variety of different applications, whether you're a pulmonologist or a cardiologist or a GI doctor. Same with MRIs. It's new technology. We need to figure out maybe better than what we've done before is just not throw it at everything. Like I said earlier, let's be specific in their use. Let's learn what we can actually learn from this stuff, and use it only to do good for the patient populations. So I think to do that, there will need to be some educational components in how to use these tools. Again, I don't think every doctor or nurse practitioner or nurse is going to need to be an expert in this. That's why you have, as you pointed out, the team member that's the expert in this, just like the doctor is the expert in that thing. And even like the doctor who's an expert in diabetes is different from one who is an expert in psychiatry, right? You collaborate on this stuff, you work together, and you use these tools efficiently and effectively to help both the patient in front of you and the population of patients that you're trying to serve as well. And so, yes, it will require some kind of a understanding of how these things work, just like when they first introduced stethoscopes, it required, or antibiotics.
Right.
You have to learn how to use these things appropriately.
Right.
Yeah.
That's
And by the way, this question was from one of our other co-founder of Doctors AI, Dr. Avnish Khare. He's from the city of Udaipur, and he's been really working very hard towards AI education amongst peer groups. But again, another question that comes as a follow-up to this, and then we'll have Dipu ask the next question, is that where does a doctor start from? So what would be your suggestion to all our medical professional audience out there? Where do they start from about AI education? Because it's such a vast world out there.
Yeah, it's a big world. I think there are a number of really good kind of overview articles that have been in good publications like JAMA and New England Journal.
Yeah.
The journal now has this AI kind of subjournal in it, but more and more in JAMA and the annals and the kind of highest quality journals you can see, there's kind of some overview stuff. So I would kind of start there, frankly. It's good. It's focused on medical application. It's focused on both the promise and the perils of this stuff, so the upsides and the downsides. And I think that's a good kind of initial start. You don't obviously need all the statistical training, just like you don't have to become a biostatistician to read a journal article and say, yeah, this is important or not. You need to kind of have a sense of what they're addressing and how they're approaching it, and say, does it make sense? But then beyond that, you can interpret kind of the results fairly clearly, even with a somewhat cursory understanding. And I think that's how it would be with AI, with, like you said earlier, having that person on the team if you need further knowledge about it, further depth, or you're trying to make a decision, is this algorithm better than this one, or what's the downsides of that one? That would be really helpful to have that person on the team.
Yeah.
Yeah.
And now we have a cool way of reading journals, right? You use a custom model that can really summarize your medical
summarize
PDFs,
it for
and it
you.
gives you the
Exactly.
summary, and you read 10 papers in 5 minutes.
Exactly. Yep.
The power of
The
generative
The
AI.
question is, are you going to absorb all of that as a human being?
Consume all of that. That's so important.
That's the upskilling part of all of our jobs, right? Like,
Yeah.
okay, great. Now we can make it concise and, feed the ADD brains that we have created over the course of the last few decades. But now you still need to know how to use it. And so that's the skill that we all need to learn how to upskill with.
And I think actually, prompt engineering is this
so
whole new
important.
field, and learning, the right prompts to use might be really a critically important part of that medical education. Learn, right? Because you can get led astray if you aren't asking the right way. It's like if you've read Hitchhiker's Guide to the Galaxy, right? You get the answer 42 because he didn't ask the question the right way. Yeah,
you didn't ask the question correctly. Exactly. Yeah. So of late in the news, we've seen an uptick on, at least in the US here, we've seen an uptick in news articles around regulation of AI. And specifically, there's been a lot of criticism of at least the FDA that I've seen in terms of not being able to kind of classify and really provide good guidance to a lot of companies on, are they SAMDs or are they not? Or where is that, where are we landing in that? And we recently had a very interesting discussion in another forum about what is that going to look like as more new technology and new tools in this space come to fruition. And so what are your thoughts on the practical and regulatory aspects of AI and current AI regulations? Because I think there's a general consensus in the community that they do need to change in some way, but no one knows in what way quite yet, especially when it comes to healthcare. And we all agree that there should be some regulation. I think no one is saying go rogue, right? But how do you frame those regulations if we're looking at adding new or amending current regulations and policies?
Yeah, I think it will evolve, to be honest with you. I mean, this field is moving exceedingly fast, maybe faster than the FDA is used to. There are, like I said, the Train and Shy, and there's an OpenAI kind of analysis or regulatory group that's led by Ricardo Leffe in Portugal and in the EU. So there's a lot of these teams who are much brighter than me who are working on particularly these guidelines and regulations and guardrails that you need to put in. To me, I mean, some of the issues I think that will be important are, the need, just almost like a drug trial once. So now we've developed this drug, we developed it on this particular population. We need to test it on other people first, on a broader audience, and not just apply it to everyone. We need to monitor it over time, because I think when I give talks, I say, the AI models of today are not going to be AI models in 5 years. So you can't just take something off the shelf and expect to revisit it in 10 years. Because the knowledge and the technology will advance, but also if you're actually doing stuff right and people's behaviors are changing, there will be a new set of indicators, a new set of ways that you might intervene in a couple of years, right? So you need to adjust it. And there needs to be ongoing monitoring, just like they have for drugs, for when they do the monitoring efforts to say, are there problems that are coming out of this that we didn't anticipate? Or just like with drugs, are there secondary applications here where it seems to work really well for this group? So and all of that, frankly, there will be a cost, just like there is a regulatory cost of anything in healthcare to do all of those things. But I think those at a minimum are kind of necessary just to make sure that, again, primum non nocere, we're not hurting people. We're being cautious about the implementation and making sure it's continuing to work.
Yeah.
Yeah. So I think that brings us to another question, which is a follow-up to this discussion. And this question has come from Andy Day from Boston, USA, and wants to know that, what are the legal ramifications for using a large language model that can, be detrimental, or that needs to be looked in by a clinician. So like, while we are talking about AI for good, the question is, can AI do harm in the medical practice if the response is not in the favor? And at the same time, who would be held responsible? I think this is a question that we are often asked to answer. So, what are your thoughts on that?
Yeah, I think that's, kind of outside of my scope of knowledge, the legal aspects of this.
Yeah.
It's really complex. I do think, as I was talking about earlier, when we talk about what's kind of fair comparisons, we need to know actually work done by Lucian Leap in Boston, in Massachusetts in 1990, found that 100,000 people per year are killed because of medical errors, right? So medicine is flawed. These algorithms will be flawed. Any technology, there's some harm potentially associated with it. The key thing is the benefits for the population outweigh the harms, and then are there kind of ways to have legal remedies if things are not done correctly, just like tort law in the U.S. Addresses these things. But the profession is far from perfect, and so I think we need to be we need to not expect and figure out what are all the legalities of it. I mean, that will be necessary to figure out. It shouldn't be an impediment to making progress and going forward.
Very true.
Yeah, if I may just follow up on that. I forgot. I didn't catch the name of our viewer, but the way to kind of look at that, because of course it's going to be flawed. Of course, you're not going to find the answers with a single. First of all, the prompt itself is going to need to be fine-tuned in many. But I like to think about these prompts and the advice that these generative models kind of spit out at us as like looking at it from a relative risk reduction and an absolute risk reduction. Like, what are the or indications, contraindication type thing? What are you truly looking for for the answer in terms of for this? And there is a little bit of a preconceived notion that you're going to go in with when you're asking the question, because you're asking the question, right? So you as the human still have the burden of judgment when it comes to the interpretation of what that large language model is going to spit out. So 100% there's risk, 100% there's flawed. We're flawed, the algorithm is flawed, everyone is flawed. And so now we're just going to try to make the best decision we can collectively, I think.
And just to add to one more thing, and I'm so glad that William is here with us. I think most of us are used to using large language models, which are built on the general data set, foundation data set. It's so very important that we have access to language models, maybe a small or a medium language model, or even a large language model that is built on medical data set, so that we can have the right use case with the right foundational model in the transformer architecture. So William, what are your thoughts on this particular thing? And like, how do we envision and how do we see Microsoft, coming up with all these projects in the AI for Good Lab, that we can have some kind of a usable open access medical large language model for the public at large? Is it something that we can really hope to get from Microsoft in the near future? I don't know. I mean, just thinking aloud.
So I
You're
don't
asking
think
for a
Microsoft. I don't think Microsoft would do. Microsoft is, likes to empower others, right? That's our
Fantastic.
our mission, is to empower others to do more, right? Every person in every organization in the world. So I don't think Microsoft would be doing that. I think the tools will allow others to do that. And
Fantastic.
like I said, these examples that we had where we're training models on large news feeds or on ophthalmological texts to be able to generate draft board questions, right? There are different ways. And I think it's just like I said earlier, right? We can't just take AI and throw it against the wall and see what sticks. We need to be thoughtful for how we use the technology and think about the use case and how it will actually be used and where it will be incorporated and what's needed. I mean, one of the challenges, you're right that this is trained on the internet, so it's everything, and surprise, there's misinformation and wrong stuff on the internet too, right? So of course you're going to get stuff that's not entirely accurate.
Right. Well, as we're finishing up, and I have the pleasure of asking your last question in terms of what has inspired you to focus on AI and social good, and what's been the most rewarding aspect of the work you've done so far?
I was an academician for years, and most of what I focused on was trying to do social good and thinking about the disenfranchised populations and equity and how can you use things. My economics background makes me suggest, and I think there's lots of research, including my own, on this, that so much of health is economically driven. Wealthy people are healthier, and if people become wealthier or have better incomes or move to areas that are kind of wealthier and better off, they will have better outcomes. So I've always been kind of passionate about that. I've always kind of wanted to do have that work. That's why I didn't go into like a private practice really, or the corporate world. So when I got this particular job at Microsoft, it's like I said, it's a perfect fit for me, because I do think these tools can be used really effectively to help, in particular, the disenfranchised, and to address the inequities, which are rampant across the world, obviously. And so I'm very hopeful about that, and it's delightful, kind of like I said earlier, to see these solutions instead of just documenting like, yes, it still is bad. Now how can we kind of help things be resolved and help address the inequities and make things more equitable? So that's kind of my hope and my desire and my inspiration for doing this work, is just I'm fortunate. And I want to share that fortune.
I think we are so happy, that and we really congratulate you and we wish you all the very best for all the work that you're doing with the noble cause. So I guess we come to the last 5 minutes of the podcast, and this is usually where our host Harshita comes in with some questions from our MedSynapse audience. But before that, I also have another question coming in. And all these questions that I've been asking are from our medical friends, from our medical professionals. And this one is from one of our startup leader, Mr. Kaustav Chatterjee, CEO of Care AI. And he would like to know that how does regional startups building small language models in healthcare collaborate with the AI of Good Lab with Microsoft, in developing and structuring their model for the better cause?
Yeah, so like I suggested, we work with not-for-profits. So if they're a not-for-profit and they're just interested in doing this, the way to do it is to send me an email, And then we start
Fantastic.
talking and we see if there's an opportunity to do something together or not.
Wonderful. So a lot of emails coming up your way. Be rest assured, William.
Yeah.
All right, Harshita, do we have some questions? Maybe we can take a couple of them before we let William go in his busy schedule from our MedSynapse audience.
Yeah, so we'll take one question. So the question is, given the rapid advancements in AI technology, how do we see its integration specifically improving patient care experience within healthcare settings? And what are some potential barriers that need to be addressed for seamless adoption?
So I think a couple of things in improving the patient experience. One, as I suggested, is I think the data, when you use large language models like GPT or Llama or whatever you want to use, the Copilot that Microsoft has, Google has their products, is it makes the data kind of much more interpretable. Patients, there's a big information disconnect between the providers and patients. So when a patient sees a JAMA article, it may be challenging for them to understand that. And JAMA, to its credit, has come out with patient pages, right, to improve that access to that knowledge. I think these large language models can do that across a whole variety of different journals and different articles and different bits of information that, again, can empower them to ask the right questions of their providers, to make better decisions for themselves as well. I'll just say something about a Microsoft product that is being produced, which is called Ambient Intelligence. It's a nuanced product. And what it is it's what used to be Dragon, right? The dictation thing that is now kind of hanging on the wall, and they're capturing a discussion of 4 or 5 people in the room and able to then write a SOAP note, the typical note that you write as a provider, and make suggestions about, oh, Mrs. Smith hasn't had a mammogram in 2 years, she needs one. Mr. Jones needs this, some lab test or something like that as a follow-up. And then to ask if the provider wants to have that. So what happens then? The provider has a much better experience. They're actually looking at the patient's eyes and not sitting over here in the corner typing, right?
Yeah.
The patient has a better experience. They're being understood and listened to. You actually, as a provider, you know this, that even if you write your notes kind of immediately after the visit, you may miss some stuff, right? And if you wait until tonight when you have 30 patients, you're going to miss a lot, right? Yeah. So this can be maybe more accurate. And even I think this technology, when used in the future, will be really helpful at identifying voice patterns, because what would happen is if Bill Weeks is depressed today, and he wasn't depressed 4 months ago when he saw you, I might use different words, right? My cadence might be different. My word choice might be different. There may be more hesitancy in my word choice, as may be the case if I'm developing Alzheimer's or Parkinson's, right? So what can happen that me as a provider, you can't remember that specifically from 4 months ago. The AI that can remember that and use your own voice as a baseline against yourself, and may help improve kind of earlier diagnosis and earlier treatment for neurological and psychological disorders, which I think would be so all of those I think would improve the patient experience, including even immediate access to suggestions from things like GPT, right? You don't have to wait 2 weeks to see your provider. You can get a pretty good idea of what's going on quickly, succinctly, in a comprehensible way that there just wasn't that before.
Yeah, and just
Fantastic.
to follow up on that for our audience member who asked the question, that work around vocal biomarkers is already well underway. It's just a matter of learning how to integrate it into these systems so that we can now use them and apply them for patient outcomes.
Absolutely, yeah.
So, William, before we let you go, there's still one more question, and I think it'll be injustice if we don't take this question up. This is from one of our medical students in India, Sanjay, okay. And he would like to know that, how do you see medical students evolving, with the use of artificial intelligence? And how do you see medical education curriculum evolving with the power of generative AI, and any plans of Microsoft AI for Good Lab on these contexts?
Yeah, so I don't know, we like I mentioned before, we're doing some work training some models on text to generate board questions, which could be helpful. We're also doing some work with pathology slides, like rare, scarce pathology slides, to generate synthetic slides that use characteristics of those slides. I mean, one of the challenges of being a med student is med students are pretty smart. And if you only have 12 slides and you know what the answer is, you just memorize the slide. It's the same problem that AI has. You just memorize the slide and you push it out. So if you see a new one, it may be tougher to learn. But synthetic generation of data will give you an infinite number of slides. Using training on particular texts will give you an infinite number of questions that you could be asked to kind of hone those skills. I think that's how it can be used in for med students. I have 6 kids, and I've always told kids, and because I have a lot of people that call me up and ask me, because I'm in this kind of somewhat unique position. And I say the future will be really great for people who work where the Venn diagrams overlap. So people who get healthcare, but also get IT. If you have that kind of overlap, you're going to be, you will be employed for the next 50 years, right? So I think if you're a med student and you're young and you're interested in doing this stuff and kind of looking for those overlaps, I think that would be a really promising career path, no matter what specialty you go into. I do tell people, I think completing a residency and becoming board certified is important. When you have that credibility, the room listens to you like they may not otherwise. So again, if you can do that, but then to have some kind of an overlap, whether it's like with me with economics or IT with other folks, I think that'll be a very promising career path.
Fantastic.
Well, on that note, we are very, very honored to have had you on our podcast today, Dr. Weeks. I have to say it's been an inspiring conversation. You are an inspiration to me and Amit, and I'm sure to many in our audience. So I thank you for taking time out of your busy schedule to join us, and be well and keep inspiring the next generation. Thank you.
That's my
Thank
job.
you so much for joining us. Thank you so much.
My pleasure.
Ashika?
Absolutely. Anytime.
Yeah. So as we draw the curtains on this insightful session, a big thank you to Dr. William, Dr. Dipu, and Dr. Amit for enriching us with their invaluable insights and perspective. A special thank you to our audience for your active participation and engagement. Until we meet again, stay well and take care. Bye-bye.